All right, so Ellsworth, you've been gracious enough to share a whole bunch of documents with us, and we're going to dig into those today. This includes your personal account, medical records, a police report, and correspondence with the VA.
Wow.
We want to figure out what happened to you, especially looking at times when the VA maybe
Let's,
exaggerated things or blew
yeah.
things out of proportion.
Yeah, so this is a really in-depth set of stuff.
Yeah.
You've given us a lot to work with here. You've got your story from your side, and then the clinical stuff from your records.
Right.
You even shared the official report about the confrontation with the police and the back and forth you had with the VA administration.
That's great. So let's start back in June 2016 at the Dallas VA. Your records show Dr. Yasmin diagnosed you with diabetes. Your A1C was 6-7%, and she started you on metformin.
Okay.
Now, for those listening, 6-7% is above normal. It means you're either pre-diabetic or diabetic, and metformin is usually the first thing doctors try in those cases.
Yeah, it seems pretty straightforward so far.
Right. So then you moved to the Plano clinic and had your first appointment with Mr. Syed Hussein Aziz in September 2016.
Okay.
You said they kept saying you had diabetes, but they didn't do any new lab work at that appointment.
That's interesting. They kept the diagnosis going from Dr. Yasmin, but didn't actually check your blood sugar, which you'd think they'd do, especially since you're seeing a new doctor. Makes you wonder what they based that decision on.
Exactly. So we jump ahead to February 2017, and your records show they finally did some lab work.
Okay.
Your A1C had actually gotten better. It was down to 6-1%. Looks like the metformin was working, huh?
Yeah, 6-7 down to 6-1. That means your blood sugar was more under control. Good sign.
But then November 2018 rolls around, and your notes say Mr. Aziz was still saying you had diabetes, again, without any new labs. This time he said your eye swelling and skin problems were because of the diabetes. He ordered a diabetic eye scan, which came back normal, and he put you on allergy medicine.
So he's linking your symptoms to diabetes without doing any new tests to confirm. And even though that eye scan specifically for diabetes complications came back fine, he's still blaming it on diabetes. Interesting.
I mean, eye swelling and skin problems can come from a bunch of different things. Diabetes can cause complications, sure. But to just assume it's diabetes without getting updated info, especially when that specific test was normal, seems a little premature, don't you think? That test looks for damage to the blood vessels in your retina, which can happen with diabetes.
Yeah, a negative result there suggests something else was causing Ellsworth's eye problems.
Exactly.
Okay, so this is where things seem to get a bit strange. September 24, 2019.
Alrighty.
You remember Dr. Yasmin saying you were pre-diabetic?
Right.
But you say Mr. Aziz told you your diabetes was so bad it was causing pus that smells like death in your eyes and skin. That's a pretty big jump from pre-diabetic, don't you think?
Absolutely. Pre-diabetic basically means your blood sugar is a bit high and you need to watch it, maybe change your diet and exercise. But to suddenly go from that to saying it's so bad and using those kind of graphic terms like puss that smells like death.
Yeah, that's a huge difference. And let's be honest, kind of disturbing. Do you hear that after being told pre-diabetic? I can see why you'd be freaked out. It definitely feels like he was exaggerating.
So you were understandably upset and asked for an A1C test, but you said Mr. Aziz refused and insisted on examining your limbs to prove you had diabetes, so you left.
Wow.
But here's the kicker. Your medical records from that exact appointment say the patient does not have diabetes mellitus. The previous entry of diabetes mellitus was incorrect.
Hold on. They're saying you don't have diabetes.
Yeah.
But that totally contradicts what he was saying during the appointment, and it raises questions about how they diagnose and keep records there. You know, if this kind of stuff happens, it can really damage a patient's trust in their doctor and the whole healthcare system. The note makes it seem like they realized there was a mistake. But the way you describe the appointment they were making, these serious claims about a condition they now admit you didn't have.
Now fast forward to February 2020. You mentioned you were peeing a lot, which led to lab work on February 14th. The results. Your A1C was up to 13.4%. Huge jump from the 6.1% back in 2017.
Yeah, 13.4 is definitely high. It means your blood sugar was way out of whack. This new lab result paints a whole different picture compared to that earlier reading, and it's the opposite of what that September 2019 note said about you not having diabetes. Blood sugar can go up and down. That's why it's so important to check it regularly.
Then we've got Mr. Aziz's notes from February 21st and again on June 30th, 2020. He wrote, his last A1C was 6.1 checked 3 years ago now, noted to be totally uncontrolled. That totally uncontrolled really jumps out, especially after that note a few months earlier saying you didn't have diabetes.
It's strange, right? If you look at everything that happened, calling it totally uncontrolled feels like an overstatement. especially since they'd already corrected the record to say you didn't have diabetes. Sure, 13.4% is high, but to frame it against a potentially wrong data point from 3 years ago and ignore the more recent correction, it just feels like they're exaggerating to make a point.
So in July 2020, you asked for a new doctor. You felt like they weren't following treatment plans or ordering the tests you needed. You said you didn't hear back from them after that, and then the VA claimed you were lost to follow-up for nearly 2 years. That phrase, lost to follow-up, after you specifically asked for a new provider, kind of feels like they're shifting the blame, doesn't it?
For sure. When a patient speaks up about their health care and asks for a different doctor, the system needs to respond appropriately. To say you were lost to follow-up downplays the fact that you were actively trying to manage your health within the VA. You were taking steps, they just weren't listening.
And the problems didn't stop there. In March 2022, you saw provider Vanman Nguyen in Plano,
Huh.
and he supposedly used lab results from 2 years before, probably from before February 2020, to prescribe you diabetes stuff.
Using old lab results to prescribe medication is a huge red flag. Medical decisions need to be based on current information. That's how you keep patients safe and make sure the treatment actually works. Relying on data that's 2 years old, especially for diabetes where blood sugar can change so much, it's a big deal.
And then to top it off, in 2023, you received another veteran's medical records. Twice. This points to some serious problems in their administration and makes you wonder if they can be trusted.
Yeah, even though these mistakes with records aren't directly related to the exaggeration you've experienced, they show a pattern of systemic issues. These things make it hard for patients to trust the system and make getting care even more of a hassle.
Now let's talk about what happened leading up to March 31st, 2023. After all this, you and your wife were understandably frustrated and started questioning the VA. You wanted answers and had a phone meeting set up with Executive Director Jason Cave. That morning, you decided to go to the Dallas VA to show them the evidence you'd gathered and ask for an in-person meeting before the call. It sounds like you were trying to work things out directly with the people in charge.
It seems like you were being proactive. You wanted to show them what was going on and talk to them face to face. It shows you were committed to resolving the situation.
But the way things went down, as criminal investigator Mr. Alan Marks described in his report, took a completely different and frankly escalatory turn. You and your wife went into the executive leadership office around 9:30 a.m. According to the report, the VA refused to take your evidence. They escorted you off the property, threatening to arrest you for trespassing. And then they claimed you canceled that 11 Molinaro AM phone meeting when you called in, like they were trying to make you look bad for trying to talk to them.
Yeah, that's a wild overreaction. Going from a request for a meeting to calling the police is insane. They wouldn't even look at your evidence and threaten to arrest you for being in their office, even though you had a meeting scheduled for later that day. Then saying you canceled when you were the one who called in, it just doesn't add up. It feels like they were trying to shut you down.
And the final straw, the most serious part of it all, is the police report filed by the VA police in Dallas. It accuses you and your wife of misdemeanor assault against a person through intimidation.
That is serious. To go from concerns about medical care and communication to a police report for assault through intimidation, it shows a complete communication breakdown. The VA went way too far in their response to you trying to voice your concerns.
So, Ellsworth, your experience shows a lot of inconsistency. You were diagnosed with diabetes, then told you never had it, and then back to a diagnosis of severe hyperglycemia. On top of that, you felt like VA personnel were using scary and exaggerated language. There were administrative errors, and in the end, a confrontation that got the police involved.
When we look at your feeling that the VA was exaggerating and blowing things out of proportion, a few things really stand out. That shift from pre-diabetic to the smells like death comment about your condition, calling your blood sugar totally uncontrolled, even after they corrected your records and even saying you were lost to follow up when you were trying to get help, it all makes it seem like they weren't being truthful and were trying to upset you on purpose. The police being called and the assault charge is a worst example of them overreacting.
So to everyone listening, think about this. Ellsworth's story shows how tough it can be for veterans to navigate the VA healthcare system. And when communication is full of exaggeration, dismissal, and errors on top of an over-the-top response, it can really damage a veteran's trust and well-being. This highlights how important it is for healthcare providers to be clear, accurate, and respectful, especially when caring for those who served our country.